Hi, I'm Grace, and today Julia, Farwa, and I will be discussing the current state of rehabilitation hospitals and facilities. All across the nation, there are different facilities that aid in the rehabilitation of many different issues. These issues can vary from physical issues that are an effect of a traumatic injury or long-standing addiction to drugs or any substance abuse, or even for mental illness such as depression or schizophrenia. Each rehabilitation center is different and unique in its own way based on the people that make up their staff, who is providing the funding, and the techniques they use to rehabilitate their patients, and whether it is an inpatient or outpatient facility. I will be describing the difference between the length or term of care provided by a rehab hospital. As mentioned before, there are so many different reasons a person may decide or be encouraged to visit a rehabilitation hospital. But when deciding to be admitted into a rehab hospital, the first thing to consider is whether someone wants to be admitted long-term or be outpatient. A person may decide to reside in a residential or otherwise known as long-term or inpatient hospital during their time of treatment because they are undergoing severe difficulties with addiction, self-harm, or illnesses. Those who would decide to admit themselves for long-term care are typically those who need to be monitored strictly over 7 days a week, 24-hour-a-day time window. For example, if someone has a severe or dangerous dependence on a certain substance or drug, enrolling themselves in an inpatient rehab facility physically removes them from their triggers and creates a more neutral environment. Moving on to the alternative, there are also facilities that offer outpatient services. The services are typically used for those who do not need intensive treatments and have other responsibilities such as supporting a family, working, or being involved in their community. Ultimately, the decision is up to the patient, but there are many personal factors to consider when making that decision.
Rehabilitation hospitals typically rely on in-person provided care by therapists or technicians. Visits usually last a specific duration and are almost always entirely planned in advance. For this reason, the quality of scheduling patients is highly important to the effectiveness and economic efficiency of a rehab hospital. The schedule for a large rehab hospital can sometimes comprise more than 10,000 appointments for hundreds of patients over several weeks, each using complex resources. Scheduling of these activities is highly complex, time-consuming, and very cumbersome. This paper, discussed by Helber and Casper, explores how to better schedule patients, as it has traditionally been done by clerks with basic computer software. The results of the study were that the researchers created a decision support system with the ability to automatically schedule activities for participants and to assign the required resources. It took into account the schedules of all other patients to create the most efficient sequence of scheduling. Overall, this paper shows that technology can better equip rehab hospitals to schedule their patients with more accuracy.
So, as Grace mentioned earlier, rehabilitation services at different hospitals differ in many ways, including their structure and technique of providing proper patient care. Every hospital may have placed emphasis in different areas of patient recovery. So the question to be asked is, what works and what doesn't? Which factors contribute to patient success? A 2016 study examined older adults' experiences in a rehabilitation hospital. The participants were all enrolled in a physiotherapy program in which patient therapy was delivered in a group setting. The participants reported enjoying their group sessions more than their individual ones, and also reported that while they were in a group setting, they felt like they were still able to receive individualized and attentive care from the instructors. They also reported experiencing an increased motivation and a sense of camaraderie with their group members. Clearly, a social component is incredibly important to patient satisfaction and improvement in rehabilitation hospitals.
Rehab centers will vary depending on the services, amenities, and other treatment options they offer within their facilities. However, there has been a major controversy regarding the rehabilitation and the scheme of stealing vulnerable patients' money. Oftentimes, a 30-day admittance into a rehabilitation center will cost well over $1,000. In extremely high-end rehab centers, there are facilities that charge over $100,000 per week. This is an extreme, but in many cases, for example in Florida, where there are very high rates of drug misuse and non-fatal overdoses, there has been a major spike in the number of rehabilitation centers across the state. However, according to many news articles, one particularly from NBC emphasizes the prevalence of questionable counseling and costly unnecessary screenings. The concept of easy money being able to be made has influenced companies and facility owners to take advantage of their patients and ultimately lower the quality of their care.
Another important aspect to consider when reviewing rehabilitation services is the access to care based on insurance. A study conducted by the American Medical Association sought to determine whether having insurance affected the outcome of rehabilitation treatment for patients with acute ischemic stroke. The study found that the uninsured were more likely than the privately insured to die in the hospital, and, of the uninsured who survived, they were statistically less likely to go into inpatient rehab. In contrast, patients with Medicare or Medicaid coverage were more likely to be discharged to a skilled nursing facility for rehabilitation. This study suggests that even high-quality care in a rehab facility cannot overcome pre-stroke health status that is often determined by insurance availability, such as receiving primary care visits. This in turn shows how insurance is critical to providing quality rehabilitation care.
Hospitals offer services to help with lower extremity amputation rehabilitation, spinal cord injury, brain injury, and stroke recovery and rehabilitation, and more. We'll expand more on these soon. Julia highlighted the importance of having insurance in order to seek treatment in rehab hospitals. What services can people receive with insurance? Individuals with Medicare, as an example, can receive medical care, physical, occupational, and speech therapy, social work assistance, and psychological, orthotics, and prosthetic services. However, there is a serious catch regarding eligibility for these services. In order for Medicare to pay for an individual's stay at a rehab hospital, individuals must require 24-hour direct access to a doctor, 24-hour direct access to a nurse with training and experience in rehab, nearly 3 hours of intensive therapy every day, and a team of providers caring for them. People with Medicare that do not meet these requirements are not eligible for a Medicare-covered stay at a rehab hospital and must pay their expenses out of pocket. These requirements are descriptive of rather extreme and serious cases, meaning most people would not be eligible for this since they would not meet the requirements. This only further increases the disparity in access to health care since it is so costly to pay out of pocket for these services.
Now, we will look at some specific uses of rehabilitation services. As mentioned in the introduction, rehab can be for almost anything. There are centers of rehabilitation for physical injuries, mental illnesses, conquering fears or phobias, and withdrawing from drug and alcohol use. Among the broad options, utilizing rehab clinics for alcohol and substance abuse is one of the most popular uses. Focusing specifically on drug rehab centers take in anyone who has a reliance or a wish to quit their drug of choice. This is a daunting and difficult task as drug addiction is truly seen and accepted as a chronic disease. When people decide to admit themselves in the drug rehabilitation centers, their ultimate goal is to quit using the drug and avoid relapse, which is known as the act of returning back to the drug after quitting for an extended period of time. However, the process of getting to this point is long-winded. According to the National Institute of Drug Abuse, the patient must find their proper treatment plan, commit to their plan for an extended amount of time, be open to other forms of treatment such as electrotherapy or counseling, and be willing to consistently be managed and monitored.
Another specific reason for the use of rehab services is due to traumatic brain injuries, or TBI for short. TBIs greatly affect an individual's autonomy and way of life. It may become difficult for those with a TBI to drive a car or even remember to take their medication. That is why rehab hospitals are so important. The overall goal of rehab after a TBI is to improve the patient's ability to function at home and in society. Therapists help the patient adapt to disabilities or change the patient's living space to make everyday activities easier. It is also important for TBI patients and their families to select the most appropriate setting for rehabilitation. Several options for rehab locations include home-based rehabilitation, hospital outpatient rehabilitation, and inpatient rehabilitation centers. This decision will be based on the severity and necessity of the TBI grade.
To summarize, rehabilitation centers around America are very different but are making changes to improve and to advance. They can be extremely expensive, but they offer many valuable services for a number of health conditions people may be recovering from. With that said, here are some discussion questions to think about. Number 1. What are some specific changes we can make to improve rehabilitation hospitals? And 2. How can we reduce stigma associated with seeking out rehab?